Hello, welcome. If you've heard about ABA and aren't quite sure what it's about, this video is for you. We're going to answer the most common questions families ask when looking for support for their children with autism or developmental challenges. Our goal is to make this information clear, comforting, and practical. Question 1. What is ABA in simple terms? ABA, or Applied Behavior Analysis, is a therapy that helps children learn important life skills, like communicating, playing, following instructions, and managing emotions, by using positive support and step-by-step guidance. Instead of punishing behaviors, ABA gently encourages desired ones, often through fun activities and clear rewards. For instance, a child might be gently encouraged each time they try to say hello, with celebration and praise when they succeed. This builds confidence and trust. Scientifically, ABA is rooted in behavioral psychology. It uses evidence-based methods like positive reinforcement, task analysis, and prompting to shape new skills. These techniques are customized to each child's strengths, needs, and developmental level. Studies such as Dr. Ivar Lova's research in the 1980s and many systematic reviews since have shown that high-quality ABA can lead to major improvements in communication, social interactions, and independence. In fact, a meta-analysis in the journal Pediatrics emphasized ABA's positive outcomes when delivered early and intensively. Many families say ABA helped their child speak their first words, sleep through the night, handle daily routines better. Question 2. Who is this therapy recommended for? ABA is especially recommended for children diagnosed with autism spectrum disorder, ASD, but it can also help children with ADHD, developmental delays, or behavior challenges. It's a flexible model, designed to meet each child's unique needs. For example, a child with ADHD might learn how to practice taking turns, or reduce impulsive outbursts, all through engaging and age-appropriate activities. Question 3. Is it a harsh or invasive therapy? In its child-centered form, ABA is designed to be gentle, respectful, and nurturing. It focuses on creating a safe environment where learning happens naturally through play, connection, and motivation. The therapist works at the child's pace, with their preferences and comfort in mind. Question 4. Where is ABA performed? ABA therapy can take place in a variety of settings: at home, in a clinic, at school, in community centers, or even online through telehealth platforms. The goal is to deliver support where the child feels most comfortable and can generalize their new skills. For instance, at-home ABA allows therapists to guide children in real-life situations, like brushing teeth or getting ready for bed. In-clinic sessions may focus on structured learning and peer interaction. Families can choose or combine formats based on what works best. Question 5. Who gives the therapy? ABA is implemented by a trained behavior technician, known as an RBT, Registered Behavior Technician, under the close supervision of a BCBA, Board Certified Behavior Analyst. The BCBA assesses your child, creates an individualized plan, and adjusts strategies as your child progresses. The therapy team works closely with families to understand goals and priorities. Question 6. Can parents participate? Absolutely, and it's encouraged. Parent participation is a cornerstone of effective ABA. Many programs offer parent training sessions to teach strategies you can use in everyday life. Research shows that when parents are involved in ABA, progress is often faster and longer-lasting. You become part of the team guiding your child's growth. Question 7. What kinds of things can my child learn? Children in ABA therapy can learn a wide variety of functional skills, everything from language and social communication to emotional regulation and daily routines. One child might learn to take turns during playdates, while another learns to express feelings using simple words or gestures. The therapy evolves as the child grows, targeting new goals over time. Many children also learn how to handle frustration, manage anxiety in busy places, or build friendships in classroom settings. The goal is meaningful independence. Question 8. Is special equipment needed? No specialized or expensive equipment is needed. ABA uses everyday objects like toys, books, visual schedules, and picture cards. The key ingredient is a supportive, engaging environment tailored to your child's interests and needs. Question 9. How long does it take to see results? Every child is different. Some families notice improvements within a few weeks, especially in communication and routine behaviors. For others, it may take a few months to observe significant changes. Consistency, family involvement, and therapist experience all play a role in outcomes. The earlier therapy begins, ideally before age 5, the more profound the results often are. That said, older children and even teens can benefit from ABA too. Progress may look like fewer tantrums during transitions, improved eye contact, or the ability to make a simple request like "I need help." Small steps lead to big wins. Question 10. Is ABA the same everywhere? Not at all. ABA is a framework, and the way it's applied varies greatly. Some therapists focus on naturalistic approaches like pivotal response training, PRT, or the Early Start Denver model, ESDM, which integrate play and family involvement. Question 11. Does ABA replace other therapies? Not at all. ABA can work in harmony with speech-language therapy, occupational therapy, OT, physical therapy, or social-emotional interventions like floor time or play project. For example, a child might attend OT for sensory integration in the morning, then ABA in the afternoon to practice transitions and communication. Coordination among therapists helps support holistic development. Question 12. How do I know if the ABA my child is receiving is appropriate? A good ABA program feels safe, respectful, and empowering. You'll see that the therapist adapts to your child, celebrates small victories, and communicates clearly with your family. Watch for signs like your child looking forward to sessions, making progress toward goals, and showing more confidence in daily life. Ask questions freely. Transparency is key. A great ABA therapist will involve you in planning and encourage open feedback. Trust your instincts. If something doesn't feel right, speak up. Remember, ABA is just one tool on your parenting journey. With the right support and information, you can make empowered choices that honor your child's unique strengths. If you have more questions, I'm here to support you. You're not alone. This path is filled with hope and possibility. Thank you for being here.